Good evening. I'm Professor Dr. Ashish Davalbag, and I'm going to record a vlog to explain to you what is the right procedure to improve your figure. As you know that there are two procedures in body contouring. One is liposuction and the other one is a tuck. And a lot of people are in a dilemma which is the right procedure for them, whether to go for liposuction or to go for a tuck. Liposuction alone or liposuction with tuck or both together. Let's throw some light on this. To understand this, we need to see what's the structure of the skin. So skin sits on top of fat, which sits on top of the muscular framework and is held together by fibrous ligaments to the underlying structures. And as your weight goes up, the fat goes on increasing, and you can assess the amount of fat by the skin pinch or skin fold thickness. This accumulation of fat can be either a generalized fat excess all over, or it could be stored in certain areas which are typical in men and women, or it could be a localized case of lipodystrophy, as in this case. So if you can see that this lady has excess bulges in her saddlebag, but otherwise she's fairly slim in other areas, and this excess or protuberance is autonomous, so that even if she loses a lot of weight, this is not going to go down. And these are patients who would respond very well for liposuction. You get rid of all that excess fat cells in that area, make them even, and they can then reduce it by diet and exercise. But these are cases in whom there is excess fat in certain areas which are typical in women, that is the abdomen, the flanks, the lower back, the thighs, sometimes the upper back and the arms as well. In men, the common areas where fat is stored is the abdomen, the love handle area and the lower back, not so much on the thighs, but the chest as well. And if it's on the chest, then it is one should consider whether there is gynecomastia. You can assess the amount of fat very easily with skin fold thickness, and this is a skin pinch, which means that there's skin fat skin in between your pinch, and it varies from areas to area. And the lesser the pinch, like less than 1 centimeter or 1 to 1.5 centimeter, means your fat percentage is low. And as the skin fold thickness starts increasing to 1 inch, 2 inch, 3 inch, you're obviously having more fat stored in that particular area. And the whole idea of liposuction is getting rid of that fat and allowing the skin to contract and redrape. This happens. This is the key determinant is whether the skin is elastic. If the skin is elastic, then after removing the fat, the skin will contract and redrape nicely and recontour the underlying surface. Like in this lady, this young girl has toned thick skin, it's elastic, there are no stretch marks and there are no scars. And if you remove the excess fat, as in this case, you can see that in 2 to 3 months she has become fairly slim and lost all the excess fat which was stored around her trunk area. This gentleman, who has a good physique, used to exercise a lot, gave up exercise and then started putting on fat, but has a good toned skin and has never lost weight. He responded to liposuction. His skin contracted well and redraped, and he got his physique back. And you can see that it all depends on the skin's elasticity. Young girls with a lot of excess fat, as in the case of polycystic ovarian disease or condition, They can also respond well to liposuction, provided there are no scars, no stretch marks, and the skin tone is good and there are no pendulous hanging folds. You can see that the skin in the abdomen which was treated has retracted and she's got a significant improvement. This is a condition called lipedema. There are many women who have a lot of fat on their thighs, on the legs especially, and one needs to rule out the condition called lipedema, where there is not only fat but there's edema as well. There's a sluggish lymphatic circulation causing swelling with excess fat, and the only option for them is liposuction. They need 360-degree liposuction. It takes a long time for the skin to swelling to go and to skin to retract, but once it does, they can get a fairly decent improvement. Those after pregnancy, if they have been fit and they exercise a lot and the skin tone is good, despite that pregnancy stretch that they have had, the skin can contract, and you can also give them a very high definition look, which is shredded look by selective etching in the intermuscular regions. Those who are into fitness and exercising and are not getting that shredded look, they can have the fat removed from which is covering the muscle, and you can make them look defined and shredded, and you can in fact transfer the fat to the muscles of the chest or shoulder and bulk it up with 4D liposuction techniques. But you can see that the skin, because it's nice and thick, has retracted well and has contoured the new figure. But cases like these who have had pregnancy with scars and stretch marks, if they insist on liposuction, then this is what can happen. The skin can hang loose, it deflates, it doesn't contract, and the result outcome is not pleasant. They need a tuck. So these are cases with pendulous abdominal skin, bulge, stretch marks, who should ideally be going for an abdominoplasty or a tuck. Those who have had a lot of weight fluctuation, like weight loss and weight gain, weight loss, their skin also loses its elasticity, and then if they have liposuction, you can see that their skin will hang too, and they should ideally be considering a tuck. So we take away the skin and fat together in a tuck and we tighten it up. There is a scar in the lower abdomen, but that pendulous fold of skin which is full of fat, if you just liposuction, would become an empty fold. But if you have a tuck, then you can take care of that fold and the loose skin and tighten it up to give you a very significant improvement. Post-pregnancy, stretch marks, bulge, or ventral divarication are definitely indications for an abdominoplasty or a tuck. The pendulous abdominal skin will never tighten if you just liposuction it. So just consider an abdominoplasty, get rid of that loose overhanging skin fold and tighten the abdominal wall. Even if you haven't had a C-section, but you've got a lot of loose skin with stretch marks in the front of your tummy and an overhang on top of the navel, then that indicates loose skin in the upper abdomen as well as the lower abdomen, and they should consider a tummy tuck. Now here we have done a near circumferential tummy tuck. You can see the tightening has really improved her central abdominal area very significantly. If you have scars, as in the older days, the C-section scars used to be vertical, these can be very effectively taken care of by a tummy tuck, and this is an early post-op picture, and you can see that it's the whole skin is nice and flat. If you've got an overhang above the navel, that means there's loose excess skin in the upper abdomen. There's also loose excess skin in the lower abdomen. Do not think twice. You are a candidate for a tummy tuck. Just get rid of all the loose hanging skin, have a liposuction at the same time, even out the skin, and get a tuck. Bariatric surgery patients also lose a lot of weight and lose a lot of fat, but they could stabilize, or they could still have loose hanging skin with a lot of fat underneath the skin. Or there are sometimes cases who lose a lot of weight even if they have not had bariatric surgery, and after weight loss their skin just hangs loose. These are cases too who should consider a tuck, where the skin and fat which is hanging is taken care of. If you have a ventral hernia or a ventral divergation and a bulge like this, then you are a candidate for an abdominoplasty. We can tighten the abdominal wall, we can get rid of the hernia, we can remove the loose excess skin and give you a very taut, tight figure. You can see the loose skin which is hanging, and this is the appearance after you've had an abdominoplasty and a tummy tuck. So it's not impossible, but we can make you from fat to fit, provided you select the right procedure and you have a consultation, and we analyze your situation and guide you to the right procedure. In summary, liposuction is for those who have toned elastic skin, who have few stretch marks, there are no scars, you have not had massive weight loss, and you don't have any pendulous skin folds. While tummy tuck is for those who have loose inelastic skin, there are stretch marks, scars, they have had a history of massive weight loss either from bariatric surgery or from dieting, they have a hanging fold of skin in the lower abdomen, or a ventral hernia. These are the cases who should consider a tummy tuck. Thank you very much for patiently listening to this video log. And if you have any concerns, do write to us. Please press the subscribe button if you want to listen to further educational aesthetic surgery videos. Thank you very much.